the scapula upward, so it is called levator scapula. And the other one is rhomboides muscle. These rhomboides muscles and the levator scapula, they are considered as deep extrinsic shoulder muscle. By the way, rhomboides muscles, there are two in number. This is a rhomboides major and this one is rhomboides minor. So rhomboides major, minor, and levator scapulae. These muscles collectively they are called deep extrinsic shoulder muscle. The others are the scapulohumeral muscle or the intrinsic shoulder muscle. Scapulohumeral muscle, by the way, you understand something from the name. Scapulohumeral means it connects the scapula that of the humerus. These muscles are, one is deltoid muscle. By the way, this deltoid muscle, it is used for intramuscular injection. Intramuscular injection, for example, Depo-Provera and other medication can be injected here at the deltoid muscle. So deltoid muscle is one of the muscle which is used for intramuscular injection. So this is one of the muscle which is considered as scapulohumeral or intrinsic shoulder muscle. The other muscles is this one, this muscle, which is it's named here. The name is shown here. This muscle we call it is teres majors. Teres major, deltoid muscles. This muscle, they are muscles. They are intrinsic shoulder muscles or scapulohumeral muscle. Additionally, the other additional scapulohumeral muscles are the teres minor, the infraspinatus, supraspinatus muscle. These muscles also called the scapulohumeral muscle, by the way. Teres minor, infraspinatus, supraspinatus, and the opposite, in the opposite direction on the anterior aspect of the scapula, there is subscapular muscle. These four muscles we call them rotator cuff muscle. They forms musculotendinous cuff at the glenohumeral joint means it is the joint formed by the humerus when the humerus articulates with the glenoid cavities of the scapula. So this is all about the posterior axilloappendicular muscle. Here, what I have shown you, this is the area where the deltoid muscle is located. So this deltoid muscle, it is used for intramuscular injection. Intramuscular injection, by the way, as you see here, the syringes, it is given the needles, it is given 90 degree, and so deltoid muscle. For some medication, including Depo-Provera, they are given here intramuscularly on the deltoid muscle. The other muscles is muscles that found in the arm. In general, the arm divided into two compartments. There are anterior compartment and posterior compartment of the arm. In the anterior compartment of the arm, in the anterior compartment here, actually, you'll find the three muscle. This muscle, by the way, we call them the BBC muscle. BBC muscle. BBC muscle. The brachialis muscle, biceps brachii, and the coracobrachialis muscle. So usually, you can remember, you know the channel, the BBC. So if you know that one, hopefully you will not forget this one. We call them the BBC muscle. This BBC muscle, they are found in the anterior compartment of the arm. All of them, they are innervated by musculocutaneous nerves. In the posterior compartment, you'll find two muscles. The most important muscle is the triceps brachii, and additionally you'll find ancones. Almost all posterior compartment muscle, including forearm as well as the arm, they are innervated by the radial nerves. So generally, in the arm you'll find totally 5 muscles. 3 are found in the anterior compartment. 2 of them are found in the posterior compartment of the arm. There is a picture that shows this muscle. Look at the BBC muscle. This is the biceps brachii muscles. This is the most superficial muscle in the anterior compartment of the arm. And this is the coracobrachialis, and this is the brachialis muscle. So the BBC muscle, it includes biceps brachialis and the coracobrachialis. So collectively we call them BBC muscles. They are found in the anterior compartment of the arms. In the posterior compartment of the arm, you'll find the triceps muscle. Triceps muscle have 3 heads. One head is here, the second one is here, the third is here in between the 2 heads. So it have 3 heads. Because of having 3 heads, it is called triceps brachii muscle. This is the most important muscles, which is found in the posterior compartment. Anconis muscle is not shown on these pictures. The other important muscle, or the other major muscle that you find in different parts of the body is the gluteal muscle. Gluteal muscles, they are found in the gluteal regions, and these gluteal muscles, they are clinically they are important, and there are 3 in number. The gluteal muscle, gluteus maximus, gluteus medius, and the minimus. These are the 3 important muscles. By the way, in the deeply to these muscles, you will find many other muscles in the gluteal region, but our main focus here is the 3 superficial muscles in the gluteal region: the gluteus maximus, gluteus medius, and the gluteus minimus. These muscles, they are used again for intramuscular injection when you're discussing the posterior axio-appendicular muscle. I told you the deltoid muscle is one of the muscles which is used for intramuscular injection. The other muscle which is used for intramuscular injections is a gluteal muscle. This is a maximus, gluteus maximus. This is a medius. Just deep to the medius, you will find the gluteus minimus. These are one of the 3 important muscles that you find in the gluteal region. Associated with this one, one of the most important reason why we are discussing muscle is because muscles, they have different clinical importance. For example, a gluteal muscle, these muscles are common site where intramuscular injection are given. So during intramuscular injection in the gluteal regions, caution should be taken, or their major care should have to be taken. You will not inject to any area of the gluteal region. First, you have to form a demarcation. The first line, horizontal line, it can be made in the upper part of gluteal cleft. You will just draw one horizontal line, and from upper part of the iliac crest, is most upper part, you will draw one vertical line downward. Then injection can be given in the outer upper quadrant. This is the safest sites of injection. You can't inject in the other 3 quadrants. The reason is why there is one largest nerve, sciatic nerve. It just passes through this gluteal region. This nerves it supplies the posterior aspect of the thigh, and all muscle of the leg and the foot, they are innervated by this sciatic nerve. So by chance, if you inject or if you give medication to this nerve, or if you penetrate this nerve, the nerve might be damaged, and you might cause paralysis to the patient. So a person coming for the treatment, you send paralyzing him or her, so that you have to take care during giving gluteal injection. You never inject into upper inner or the both lower quadrant. You can't give injection, should be given in the outer upper quadrant only, all the time. If you have given, for example, if you have injected Rabicin, there's a probability of damaging the sciatic nerve. This is the most important nerve applying the leg, the foot, and the posterior aspect of the thigh. So you have to take care of. So always during injection, draw this line from the gluteal cleft, the horizontal line, upper part of the gluteal cleft. From the upper part of the iliac crest, just draw one vertical line downward and just inject. You can give injection in the outer quadrantes. So major care should be taken, or major caution should be taken during the intramuscular injection in the gluteal regions. The other one is the muscles of the thigh. Muscle of the thigh, we classify them into three, or we classify them into three compartments: anterior, medial, and posterior compartment. Muscles which found in the anterior compartment is their extensor for the knee joints. Muscle found in the medial compartment, they are adductor, they adduct the thigh. And muscle which is found in the posterior compartment of the thigh, they are flexor. Muscle, they flexes the knee joint. Let's begin from the extensor groups. The extensor muscles in the anterior compartment of the thigh, all of them, they are innervated by the femoral nerve, and this includes sartorius muscle. By the way, this sartorius muscle, it is used for tailing. Tailor usually they use this muscle during tailing closes. The second extensor muscles, or muscle in the anterior compartment of the thighs, the quadriceps femoris. Quadri means, it means four. So quadriceps femoris, they are the composition of four muscles. These muscles are vastus lateralis, vastus medialis, vastus intermedius, rectus femoris. These four muscles collectively we call them quadriceps muscle. So the quadriceps femoris and the sartorius muscle, these muscles are the muscle which is found in the anterior compartment of the thigh, or we call them the extensor group. Their function is they extend the knee joints. The muscles are shown here. This is the sartorius muscle. This is the muscle that I told, by the way. This sartorius muscle, this is the longest muscle in the body, this sartorius muscle. And this sartorius muscle, they produce flexion at the hip as well as at the knee joint. So it used for tailing, the tailor usually. During tailing the clothes, they use these muscles. So it is called tailor muscle, the sartorius muscle. And the others are the quadriceps muscles. The quadriceps muscles, they are four muscles. The first one is a straight muscle, we call them the rectus femoris. This one is vastus lateralis, and this one is vastus medialis. The vastus intermedius, when you remove rectus femoris, deep to rectus femoris, you will find vastus intermedius. So generally they become four quadriceps muscles. You will have four quadriceps. All the three are shown here: the vastus medialis, vastus lateralis, rectus femoris. Just deep to rectus femoris, you will find vastus intermedius. Deep to rectus femoris, in between vastus medialis and lateralis, you will find vastus intermedius. These are the muscle which is found in the anterior aspect of the thigh. Also, among muscles which is found in the anterior aspect of the thigh, there are muscles that used commonly for injection, especially in case of children. In case of children, vaccine or some injections, usually it can be given on the thigh. So usually you will give on the lateral. That means you will give in the outer part of the thigh. The reason why you are giving in the outer part, or the reason why vastus lateralis is the most choice muscle among muscles of the thigh, here on the anterior aspect, directly on the anterior aspect, you will find femoral nerves. On the medial side, there's obturator nerves. So to avoid damage to these nerves, usually injection will be given in the lateral aspect of the thigh, or it is given in the outer aspect of the thigh. Here is the site of injection, so vastus lateralis here. Injection, especially in case of children, you give in this area, especially during vaccination. Vaccination pentavalent, usually they are given at this muscle, vastus lateralis, in the outer part of the thigh. This is the side. So muscles of the thigh also, they are used for intramuscular injection. The other muscles, muscle in the medial aspect of the thigh, we call them the adductor muscles. The adductor muscles, I think it is the adductor magnus, adductor longus, adductor brevis, and the pectinis muscle. These muscles, they are found in the medial aspect of the thigh, and their main function is adduction of the thigh. And almost most of them, they are supplied by obturator nerve, except the pectinis and the hamstring part of adductor magnus. Adductor magnus, by the way, it have hamstring part and it have adductor part. So hamstring part is supplied by another nerves. So here the pectinis are cut in this pectinis muscle is shown. Deep to pectinis, you'll find adductor brevis, this adductor longus, and the adductor magnus, large muscles. These muscles, we call them adductor muscle. They are found in the medial aspect of the thigh. The other thing are the posterior compartment of the thigh. In the posterior compartment of the thigh, you'll find the hamstring muscles. Maybe you know, have you ever heard hamstring injury? Hamstring injury, usually this hamstring injury is common in football player and athletics, especially this will be resulted due to inadequate warming. Before exercise, hamstring injury may happen. Hamstring injury means if this hamstring muscle have been torn from their origin. The origin is scalp tuberosity. We call them that hamstring injury. Hamstring muscle or muscle in the posterior compartment, they have common feature. For example, all of them, they are arrive from scalp tuberosity. Their attachment or the insertion is either tibia or fibula. They are innervated by tibial division of sciatic nerve, almost all of them, except short head of biceps femoris. This is innervated by common fibular division of sciatic nerve. In general, all of them, they are innervated by sciatic nerves. This hamstring muscle or muscle in the posterior compartment of the thigh, they extend the hip joint and they flex the knee joints. And the muscles are semi-membranous as biceps femoris, semi-tendinous. These three muscles, we call them hamstring muscles. If you had hamstring injury, it is due to damage of this three muscle. Maybe sometimes the muscle might be torn from the origin, or there may be pulling of muscle. This may lead into hamstring injury. The hamstring muscles are shown here on the pictures. By the way, what you see here on these pictures, here you'll find the semi-tendinous muscle. This one is the semi-tendinous muscle, and this one, which is found deeply on each side or deeper to the semi-tendinous muscle, is the semi-membranous muscle, and this muscle is the biceps femoris. Biceps femoris is shown here. Also, biceps femoris is shown here. Biceps femoris, by the way, it's called biceps femoris because the two heads. This is the short head and the long head. by the way, the long head of Biceps femori and the others heads of semimembranosus and the semitendinosus, all of them, as you see, their origin is from ischial tuberosity. When the muscles have been torn here from this ischial tuberosity, we call it that time hamstring injury, or sometimes due to inadequate warming, this muscle, they may pull. Pulling of this muscle also may cause hamstring injury. So this is all about for today. Hopefully you understand what I've said. Please stay safe. I'm sure we'll pass this hard time, and hopefully we'll meet again. Until that, stay safe with your family. Thank you. Bye bye.